How to treat scleroderma. Scleroderma is a relatively rare disease that causes skin and other body tissue to thicken. While there is no cure for scleroderma, there are many treatments that can ease your symptoms and greatly improve your quality of life. If you're concerned that you might have scleroderma, we've got you covered with all the information you need about how the disease is diagnosed and treated.
Scleroderma is a type of chronic autoimmune disorder. When you have scleroderma, your immune system mistakenly attacks and damages healthy tissues. This leads to the buildup of hardened, scar-like tissue in your skin and other parts of your body. Scleroderma is also a rheumatic disease that can cause inflammation, pain, swelling, and stiffness in joints and tendons. Scleroderma isn't an infection or type of cancer, and it isn't contagious. The condition can be either localized or systemic. Localized scleroderma, also called morphea, only affects the skin. Systemic scleroderma, or sclerosis, affects large areas of the skin as well as your internal organs. Localized scleroderma typically affects the skin on the chest or abdomen and sometimes on your arms, legs, hands, or feet. It rarely spreads to other parts of the body, meaning it's unlikely that localized scleroderma will turn into systemic scleroderma over time. Scleroderma is relatively rare. Only about 300,000 people in the US have scleroderma, most of them women between the ages of 30 and 50. While men can also contract the disease, they're much less likely to get it than women. The exact cause of scleroderma is unknown. A buildup of collagen in the skin and other organs leads to scleroderma, but doctors aren't sure why this happens. Scleroderma sometimes occurs in conjunction with other autoimmune disorders. Scleroderma is more common in people who've been exposed to silica dust, such as miners, foundry workers, and roofers. Children with scleroderma are more likely to have a blood relative who also has the disease, leading doctors to believe there might be a genetic component. Symptoms vary depending on which part of the body is affected. Hard, thick, tight skin is the hallmark of scleroderma. Other symptoms may develop depending on where that skin is located. These symptoms include hair loss, dry, itchy skin, discolored skin, occasionally a salt and pepper look, which might be a sign of systemic scleroderma, joint stiffness and inflammation. Muscle shortening and weakness. Your fingers and toes may turn blue or go numb. This condition is called Raynaud's disease, in which the small blood vessels in your fingers and toes contract. This happens in response to cold temperatures or emotional distress. Raynaud's disease also occurs in people who don't have scleroderma. However, it's one of the first signs that you might have systemic scleroderma. Some symptoms indicate your internal organs are affected. If you have systemic scleroderma, it can affect your internal organs. Without treatment, some of these symptoms may be life-threatening. Signs that scleroderma is affecting an internal organ include heartburn, diarrhea, constipation, high blood pressure, abnormal heartbeat, shortness of breath, lack of sex drive. See a dermatologist or rheumatologist for diagnosis. Dermatologists diagnose diseases that affect the skin, while rheumatologists diagnose diseases that affect the joints, muscles, and bones. Both have experience with scleroderma. It can take time to get a diagnosis, so be patient. Online support groups might be able to recommend a doctor who has experience with the disease. Dermatologists usually diagnose scleroderma through a skin biopsy. The dermatologist removes a small piece of your skin that has hardened or thickened and looks at it under a microscope. While the biopsy can't tell the dermatologist if you have scleroderma, it can help them rule out other possibilities. Based on the results of the biopsy, the dermatologist might order additional tests or refer you to another specialist for examination. Blood tests, X-rays, and other tests also help diagnose scleroderma. Unfortunately, there's no single medical test that can tell a doctor definitively if you have scleroderma. All of these tests help your doctor eliminate other possibilities. With a blood test, your doctor will look for elevated antinuclear antibodies. Although people with other diseases also have this, it occurs in 95% of scleroderma patients. Prognosis. There is no known cure for scleroderma. The U.S. Food and Drug Administration (FDA) hasn't approved any drugs specifically to treat scleroderma. All treatments revolve around easing symptoms, but they don't make the disease itself go away. Some immune suppression medications can slow the progression of scleroderma, but they don't stop it completely, and the condition will return if you stop taking the medication. Most scleroderma patients have a normal life expectancy. Despite being a chronic condition, scleroderma doesn't typically cause you to die any earlier than you would if you didn't have it. However, it can cause more stress than usual. Scleroderma requires continual medical care to manage symptoms. If you've been diagnosed with scleroderma, always be open with your doctor about your symptoms and how you're feeling. Even something minor can develop into something more serious if it isn't addressed promptly. Your condition may stabilize and the disease might go into short or even long-term remission. However, you should still see your doctor on a regular basis and monitor your symptoms closely. Skin problems may fade on their own in 2 to 5 years. Join a support group to help cope. Online and local support groups give you the opportunity to commiserate with others who have scleroderma. This is a place to share jokes, stories, and news about promising treatments. Because stress can impact scleroderma's severity, stress management techniques are extremely important. Other patients can share methods that have worked for them. Take an active part in maintaining your own health. While your doctors can prescribe medications and offer other treatments that help you manage your symptoms, you have a role to play as well. Self-help strategies for scleroderma patients include: dress in layers to keep warm. Avoid cold and wet environments. Quit smoking. Wear rubber gloves when using household cleaners. Get regular exercise. Keep your skin clean and protected. If you have scleroderma, your skin is dry and fragile, especially the hardened, thick skin in affected areas. Wash your skin gently and apply moisturizer immediately, then cover it with clothing to keep it warm. Because tattoos injure the skin, dermatologists advise against getting a tattoo if you have scleroderma. Talk to your doctor if you want to try to become pregnant. While you can become pregnant if you have scleroderma, there is a slightly heightened risk of miscarriage. Your doctor can evaluate your current symptoms and advise if getting pregnant is a good idea for you. Younger women with scleroderma are at greater risk of infertility compared to older women who've already had children. Pregnancy poses greater risks if you have systemic scleroderma than if you have localized scleroderma.